Good afternoon, Dean Salides. We are making a documentary film and we would like to interview you about salicylates, acetaminophen pesticide regarding their use, side effects, and the treatment for these side effects. The objective the objective is to educate the viewers about the possible toxic effect, salicylates, acetaminophen, and pesticides, and the treatment that should be done. First question. What can be the toxic or side effect of salicylate overdose?
So first of all, salicylate is under the name of acetyl salicylic acid. So it is acetyl salicylic acid, so meaning it is an acid. So the treatment, based on its pH of being acidic, the side effect number one is gastric irritation. So it may irritate the mucosa of the stomach being an acidic substance. The second most common side effect of the drug is bleeding. So pertaining to the two most common side effects, the treatment that could be done after being intoxicated by salicylate is number one, do not initiate vomiting. So it is an acid, so it may also be dangerous to the esophagus. So once it is ingested, it must be remained into the stomach, and the patient should be given substance that can absorb the poisonous material, such as an activated charcoal. And then, definitely you have to stop. You have to stop the use of the particular drug, and by thorough medical history, you must confirm that it is actually aspirin or salicylate. And then, so that's the main treatment in the in patients who has an overdose of salicylate by an absorbent substance called the activated charcoal. Now, for the second side effect, which is bleeding, um, primarily it is best to prevent the overdose of aspirin. Now, in case there is an overdose of aspirin and there is already bleeding, such as epistaxis or hemoptysis or hematoma in the patient is given an um, vitamin K, vitamin K injection, uh, to promote clotting and to minimize bleeding. And we have another substance which may control the bleeding, such as the tranexamic acid.
Second question is acetaminophen. What can be the toxic or side effect of acetaminophen overdose, and what is the treatment that should be done?
Okay. There was a time that acetaminophen was banned in the U.S. due to the toxic side effect of acetaminophen, or popularly known as Tylenol. No? Now, it has a side effect of hepatotoxicity. It is dangerous to the liver. So, for the second question, the treatment that should be done after being intoxicated by acetaminophen, um, just like in salicylate overdose, we may not induce vomiting. We might give na lang an absorbent in the form of activated charcoal. And more or less, we must protect the liver because of the toxic dose of acetaminophen by giving silimarin or other liver supplements.
For pesticide, what can be the toxic or side effect of ingestion or too much inhalation of pesticide? What is the treatment for ingestion or too much inhalation of pesticide?
Now, number one, side effect of too much ingestion or overdose of any pesticide for that matter, there will be gastric irritation again, and it may irritate the stomach mucosa as well as the mucosa of the esophagus. And again, with the use of pesticide, the patient may be drowsy, so there is a nervous system side effect pertaining to the drug. Now, too much ingestion of pesticide, again, we do not initiate. First is to confirm that you have an overdose of such substance. You have to confirm in your medical history that it is really an ingestion of pesticide. And then second, we will give through the nasogastric tube a substance called the activated charcoal again, which is actually, as we all know in pharmacology, activated charcoal is the universal antidote. Okay, so we may give the activated charcoal to absorb the poisonous material.
Okay, Dean, thank you for that information. Good afternoon again, and thank you so much.